with her.
Thank you so much, Valen. Well, now we turn our attention to the role that science plays in our medical well-being, our health. And we know that South Africa's healthcare system is in need of any help that it can get with this regard. We're going to find out what the Medical Research Council does in order to facilitate or assist government and ordinary South Africans in making sure that we are healthy and we are well in all that we do. I'm joined by the President of the Medical Research Council now. It is Professor Glenda Gray. Prof, a very good morning to you. Thank you so much for joining us.
Good morning. Yes, the Medical Research Council is the largest funder of medical research in Africa, and we fund and conduct research that impacts on the lives of South Africans. So any intervention that we find must be able to be implemented in a healthcare system that works very well. And so we're very interested in trying to understand why the health system in South Africa is so fragile. And so we invest heavily in health systems research. We try and understand from the personnel, the nurse, the doctor, to the procurement system, to the whole flow. And so we're very interested in triaging and in having a client-centered approach to the health system.
And what have you found in some of your research?
We find that nurses aren't trained to manage the health system very properly. They are under-supported. They don't understand health administration. We find that the issues around procurement, about drug facility, getting drugs into the clinic, managing flow, managing the paperwork, nurses are not supported in this area.
And also when it comes to the issue of HIV, not only in South Africa, across the continent, still very much something that we need to focus on. I know the media doesn't focus on it as much as it should right now because of other issues, but we really need to take a look at that and the vulnerability of women when it comes to HIV, is it not?
Women are incredibly vulnerable to HIV. Young women between the ages of 15 and 25 have twice more infection than men, their counterparts. So we have to understand the factors that affect HIV acquisition in women. We know that it's behavioral, we know that it's medical as well. We know that women's vulnerability, the intimate partner violence, affects women's susceptibility to HIV. We know that the economic dependence on men make it hard for them to negotiate safe sex. So we need to find biomedical interventions that can protect women, that they can use. Men have condoms, men have male circumcision. At this stage, women have nothing to empower them to protect themselves against HIV. And we need to find an HIV vaccine, we need to find a microbicide, we need to find things that women can take in their own hands and protect themselves against HIV.
And that's where science meets the reality on the ground. Natural sciences meet social sciences. When things like perhaps the surface area among women being larger, and that's where they're more susceptible, perhaps to acquiring HIV, and circumcision drives by government come to the fore. But let's speak about vulnerability in general to disease in Africa. Poverty, very key.
Yes, so poverty drives a lot of diseases, so not only HIV but TB. It drives your inability to access healthcare when you're pregnant, and so we have to try and understand women's context in Africa. And we can design biomedical interventions, but we don't understand women's context. It's hard to implement. We know that PMTCT can reduce mother-to-child transmission. We know that if women take ARVs during pregnancy, during breastfeeding and beyond, they can protect themselves and their babies. However, women are reluctant to enter the health system. They feel stigmatized, they feel ostracized by the healthcare setting, they feel ostracized by their community. And so even if we do find biomedical interventions, if we don't understand women's agency and the way their lives are constructed, whatever we do, whatever pill we make, whatever intervention, vaccine we make, if we don't understand how women need to use it and their lives, whatever we do will be a failure. And so we have to, the biomedical science has to interact with social science. We have to understand the context of women's lives, why they make certain choices, why they get infected, what kind of agency they have in their community and in their home. And so if we don't work with the social sciences, whatever intervention we create will never be implemented.
Community buy-in is absolutely key. What are the solutions? What's the way forward as briefly as possible?
Well, I think there are a lot of solutions. The MRC is very interested in understanding women's vulnerability, particularly to violence, and how we can find interventions. We've just got a big grant from DFID, 300 million rand, and we will be looking at interventions to reduce women's vulnerability, particularly to violence, not only in Africa, not only in South Africa, but as far as Afghanistan and Pakistan. So we're interested in women all over the world and not just in Africa.
Wonderful. Thank you so much for joining us, Prof. And there's that magic phrase that I used a little bit earlier, gender tool. Absolutely important when you're doing scientific research. Valen, I am learning a lot right now, and I hope you've enjoyed the broadcast so far. But I'm going to hand it back to you for an update on what's happening in the sport.